Today I'm going to talk a little bit about gynecomastia, or male breast enlargement. So male breast enlargement is a very common affliction that a lot of men get. Actually, most men get some sort of gynecomastia in the teenage years. And usually in ages between 14 and 16, patients get enhancement of the breast glandular volume, and it usually goes away. But about 14% of people have persistent enlarged male breast tissue. In addition, patients can have enlarged breasts related to their body habitus, meaning if they're a little bit obese. So you can have enlarged breast tissue or enlarged breast fat or a combination of two. And typically the treatment for it is surgery. These can be a combination or a single modality. It might be a removal of the fat with something like liposuction or excision of the breast glandular tissue or a combination thereof. Sometimes if there's excess skin, that needs to be treated as well. And that might be treated with excision of the skin or by the use of an energy device to try and tighten that skin. So when I'm doing liposuction for removal of the breast fat, typically I use several ports for access to remove that fat. First, I put in a tumescent solution. That's a combination of saline, lidocaine, and epinephrine. And we place that through small little incision, small little 0.5 centimeter incision, and we place that through all of the breast tissue in multiple directions. We let that sit for a little bit, and then I come in afterwards and I remove it with liposuction through the same port. But I want it to be an even removal, so I also use a secondary port for the removal as well. And that gives us a nice contour for removal of the breast tissue. If I need to remove breast glandular tissue, I have to make a somewhat larger incision for removal of that tissue. And basically I use that through the lower portion of the areola, which is the dark area around the nipple. Through this area I make a small incision and dissect out that breast tissue that's adding to the breast volume. When there's excess skin to the breast, then sometimes there needs to be something done for the removal of that excess skin. And obviously we're trying to minimize scars, so if I think there's a good chance that that skin will contract, I'd like to give it a chance to allow that skin to contract. But sometimes I might help it along by using an energy device that tightens the underlying skin. And the device we like to use here is the Renuvion by J Plasma. And this basically heats the underlying tissue using a helium plasma device. And over a period of 6 months, the collagen becomes stronger and tightens the surrounding skin. However, on occasion, that's not enough. And in those circumstances, we may need to remove skin that's either around the areola or even some of the vertical skin. It really depends on how we customize things for the patient.